strength, energy, endurance. Those are three things that athletes are trying to get when they use these performance-enhancing drugs. Now, there's some debate as to whether it actually works, but the athletes seem to think that it works, and they often continue using them. So in some sports, strength is more important. In other sports, like let's say biking, endurance is also important. So athletes in different sports will take drugs that they think are tailor-made for what they need. And authorities sort of caught on to this in the 1960s, and they've been trying to stop the doping, but they haven't really been able to stop it completely. Some performance-enhancing drugs actually are real medicines, and they're legal if a doctor prescribes them, but they're not legal if a doctor doesn't prescribe them. And then in addition, governing boards of various sports have told athletes, you cannot use these. It is illegal in our sport for you to use these. So human growth hormone is a real drug that doctors actually prescribe to patients, but athletes sometimes abuse it because they think that it increases their muscle mass and they think that it increases their performance. So human growth hormone has legitimate purposes. Doctors give it to children who are very short to help them grow. Sometimes AIDS patients who are having wasting issues, who aren't gaining enough weight, they're given human growth hormone, but it's not supposed to be used to enhance athletic performance, and governing boards of sports have made that very clear. It can be very hard to check for these PEDs, and that's because the abusers are always several steps ahead of the people who are doing the testing. So people who are doing the testing have figured out, you know what, we've got to get better at testing for these drugs. So one of the things that they've started to do is in some sports, the minute that you win a medal, they whisk you off and they test you because they want to see if you have any drugs in your system right at that time. There are so many downsides to using these PEDs. Now, one that a lot of people know about, roid rage. Using steroids can just completely change your behavior. And then on the other hand, PEDs can make you depressed. They can also give you heart problems, they can give you diabetes, and sometimes athletes in their pursuit of what they think is going to be their best performance, they don't think about these things, but these side effects can really happen.